started. I will start chatting, and we're going to talk today about Livestrong, what we do at our organization, how we focus on the need for access and equitable access to care. We'll talk about cancer and the intersection of all those things and the direct programs that we have to serve everyone, and kind of how we're managing and dealing with some of those access issues. So the first thing that I wanted to do is really talk and remind everybody what Livestrong does. So we've been around for 28 years, which is a little bit hard to believe. You may remember us with the wristband. We are still here, haven't gone anywhere. From the very beginning, we've been focused on one mission, and that's to improve the lives of anyone affected by cancer. When we say anyone, that means not just the person who is diagnosed, but their entire ecosystem. Because we know once diagnosis occurs, the whole ecosystem is truly shattered. So our focus is quality of life. How do we improve somebody's quality of life when they are going through this journey? Whether you're the patient, you're the caregiver, you're the next door neighbor, you're the best friend, you're the loved one. So that's our focus, our primary focus. We're interested in the cure, sure, but really we're letting other organizations fundraise and really work towards that. There are almost 20 million people living in the United States with cancer today. For them, a cure is great, but they've already gone through treatment, right? They're already living with the after effects of that treatment and maybe even still with the disease. And so those are the things that we're focused on. We truly believe that where you live, who your parents are, which you had no control over, and where you live should not dictate the care that you receive, and certainly not cancer care. So we attack this in a few different ways. The first one that I want to talk about today is fertility. Fertility is a big issue, and it's not something that a lot of people think about when you're talking about cancer. So if anybody here has been affected by cancer, I'd certainly love to know. Drop that in the chat if you have questions while I'm talking. Please go ahead and drop that question in, and I'll make sure to try to answer it along the way. So when it's diagnosed with cancer, there is a finite amount of time before treatment begins. Of course, that's different for everybody. But if you're someone in that AYA group, so adolescents and young adults, if you're in the AYA group and you are in those childbearing years, you have this really tiny amount of time in which to preserve your fertility. Oftentimes, treatment, both immunotherapy, chemotherapy, radiation, can be detrimental to your future ability to have children. The average fertility cost of preservation cost for a female in the United States is $12,000. Almost without exception, that is not covered by insurance, and it is not covered by Medicaid. That's the part that I'm going to focus on today. So we are working state by state to get insurance, to get state laws to mandate that they have to cover fertility preservation for cancer patients, but it's going to take time. So we're 18 states in, which is great. Definitely making progress along with our partners who are helping us do that. In the meantime, though, what we also know is that in all of those states, we're looking at Medicaid not covering fertility preservation. So that means if you have enough money to have private insurance, if you have enough money or you're privileged enough to have a full-time job with insurance, then they may or may not cover your fertility program, your fertility preservation. If you're on Medicaid, you're absolutely out of luck there. This is, of course, the group that needs help the most. So how do we help? We have a fertility program. We serve over 1,000 people a year in this program. Overall, we've served over 17,000, saving them over $100 million across the lifetime of the fertility program. We have 125 clinics in our network, our partner network, all around the country. When a client comes to us, a potential patient comes to us, they fill out a pre-qual form. So if any of you are in the healthcare space and you're working with people who are affected by cancer, newly diagnosed, they'll come to us. We'll qualify them. So as a single person, as long as you don't make more than $130,000 a a year, then you qualify for the program. You just have to be in the United States legally. You don't have to be a citizen. You just have to be here legally. Those are the two primary ones, and you have to have cancer. Having chemo because of sickle cell or another disease does not qualify you for this program. We just don't have enough money to cover all of that. So cancer is our lane, and that's where we stay. So you'll come in, we'll get you qualified for the program. All of our network clinics have agreed to discount their services by at least 25%, most of them significantly lower than that. The lowest that we see on average is $5,500, which is significantly lower than that $12,000 average, obviously. So we're really proud of that. And then in addition, those the fertility meds, the stimulation medications that women have to take will often be about $4,500 per cycle. Many women need 4 or 5 cycles in order to preserve enough eggs for a future child. You can only imagine how expensive that adds up very quickly. Our partnership with EMD Serono allows us to give that medication to those patients for free at no cost. So again, fertility, really important there. If you have clients, if you have anyone you know, but certainly people that you intersect with in the healthcare world that need preservation assistance, definitely send them to us. State of New York is a great example. State of New York, we've got 7.2 million people on Medicaid. Of those, when we've been serving New York for a very long time, they have passed a law that private insurance there does have to cover fertility insurance. So we were seeing, it's one of the largest states that we have when it comes to volume of cases and patients that we're serving. Prior to the law passing, about 70% of the people who were applying had private insurance. And today, it is exactly the opposite. So today, we're looking at almost 75% of the people who are applying in the state of New York have Medicaid. And so we're really seeing that vast difference. Excited to be able to serve that community, but it's another unfortunate marker of access to care. So that is fertility. I hope, like I said, that you'll send people to us. Second one I wanted to talk about is exercise. So exercise is vital to recovery. Studies show this. It's not just Suzanne saying it, I promise. There are peer-reviewed studies out there at many different levels. And for years and years, we have known that what you don't need to do when you're recovering from cancer is rest. It's the exact opposite. So you need to get out, you need to move. It's really important to recovery. We know that if you are moving, you are 5 times less likely to have a recurrence than someone who is not moving and is not exercising during their recovery. So exercise is really important. We started Livestrong at the Y back in 2007. And in 2007, we had this amazing partnership. Today, you can still do it, still very active today. You can go into a Y, sign up. It doesn't cost you anything to take this 12-week program to get you back into the gym, get you back moving again. But it's exercise that's appropriate for people who are recovering, because this does not, cancer steals a lot of things. Mobility can oftentimes be one of them, certainly muscle strength, bone loss. So all of these trainers are specially trained so that they can work with people who are in recovery. What we recognized a couple years ago is that while the Y program is phenomenal, not every town has a Y, and not everybody lives near one, and not everybody wants to go to a gym. Some people are not going to go to the gym because they're immunocompromised. Sometimes it's just not the space for them. So I wanted to make sure that we could expand our access to this program. So we created Cancer Fit. You can go on livestrong.org. You can learn more about it there. But essentially, Cancer Fit is an expansion of our Livestrong at the Y program. We've built a Train the Trainer program. So if you have, if you're a healthcare entity and you happen to have PT, anything like that, we certify trainers to work with people who are coming out of cancer treatment. So we've got a Train the Trainer program, very accessible, very affordable. We want personal trainers all over the country to be able to have those tools on board so that when their clients come to them, they're able to work effectively and safely with this important group. We've also created over 250 on-demand videos that are workout videos. So again, you can jump on YouTube, grab those videos. It's $5 a month. Tried to make everything that we do less than a cup of coffee. Sustainable for us, but accessible for most. So for $5 a month, you have access 24/7 to over 250 exercise videos that, again, are appropriate for someone recovering from cancer. And then we also have a live virtual class happening every single day. So you can come online, again, to livestrong.org. People can take classes there. And if they like that live interaction, we've got a live trainer who is ready to work out with you. So that's Cancer Fit. Again, expanded it outside of the why because we want to have access and bring access to everyone. We're working now to expand this into programs in community centers across the country to find other ways that cities, communities can bring Cancer Fit to their residents at low or no cost at all. All right. Next thing that I want to talk about is Medicaid. So Medicaid is a big one. Everybody, I think, probably is very familiar with HR 1, the new tax bill that passed not too long ago over the summer. There's some new requirements for Medicaid that do impact the cancer community. Right now, there are about 2 million people, 2 million active cancer patients who are on Medicaid. It is paramount that they're able to continue to have coverage. I don't know if you've read the bill, and I'm happy to send this to you all afterwards. If you'd like it, you can just email me. I'll send you a brief on the Medicaid bill and how it impacts cancer patients. But essentially, starting December 31st of 2026, states are going to be required to report to the federal government every 6 months, at least every 6 months, who is qualified on their Medicare rolls. They have outlined new requirements for anyone receiving Medicaid. One of those, and if you don't meet any of the exceptions, then you have to work or perform community service, documented and submitted to your state of at least 80 hours per month in order to continue to receive Medicaid. So you can imagine how challenging this is going to be if you have cancer. It's going to be challenging anyway, but it's certainly going to be challenging if you're trying to recover from cancer. There's some exceptions to this rule. If you are under 19, if you're over 64, this rule doesn't apply. If you're a veteran, this rule doesn't apply. If you're in a substance abuse treatment program, this rule does not apply. If you are considered medically frail, this rule does not apply. This is a line that we're most concerned about, medically frail. The person that gets to decide who's medically frail and who is not is an administrator somewhere in a state. And that means state by state, that definition is going to vary. In fact, in the oncology community, you'll find that that definition varies by physician. So this is a really difficult thing. We're working hard to find a way to get a second or another exception added to that list. And I'm very hopeful that maybe sometime very soon in the future, another exception will say active cancer, a patient in active cancer treatment will be an exception as well. So Medicaid is something that we're really paying attention to this bill. Obviously, it's going to inhibit access to care. And we know that if patients, that those 2 million people who are actively receiving treatment, if they don't know that they are required to submit documentation that they're medically frail or that they have to work during this period of time, that their benefits will be cut. They are not required, the states are not required to give notice, and they will have to reapply for benefits. So this is a piece that we're really concerned with, and we're actively trying to get the administration to add an exception for active cancer patients who are in active treatment right now. So that's kind of an overview of some of the big things we're doing. We're also intersecting with AI. We have created the very first AI cancer survivorship companion. Her name is Ellis. So if you think of Livestrong, LS, we just spelled it out, Ellis, ELLIS. And she is a 24/7 cancer survivorship companion. It is a closed loop AI, meaning that She cannot hallucinate. She only knows what we teach it. And the our companion, Ellis, is built on the guidebook, which is 28 years of cancer survivorship expertise. And then we add to that knowledge with vetted, trusted partners, peer-reviewed journal articles, what I call non-Facebook facts or apple cider vinegar cures. Those do not appear in Ellis. So she's a companion to help guide, what questions do I ask my doctor today at my visit? What are other treatment options besides tamoxifen? All sorts of things like that. It's available on our desktop for free. We've rolled it out in as an app in the Apple Store, and on Google as well. So excited about that. The future of cancer survivorship is really bright, but we are at a crucial turning point, I think, for the cancer community, both in research dollars that are no longer being funded, trials that have been halted from NIH, where we had a lot of metastatic patients receiving care and treatment in those trials. Those trials have stopped because of the government shutdown and also because of the pause in funding to NIH. So we're advocating for continued funding at NIH, CDC, and across the board. From a survivorship side and the quality of life side, we've got a lot of work still to do, but we're going to be just as brave as cancer patients are. So we're here for survivors, their caregivers, anyone affected by cancer. Okay, so that's what we're doing at Livestrong. I don't know if you guys have questions, comments. How can I help you? I'd love to know, but I will save these last 10 minutes or so for questions, anything. My favorite color. I have fish. There's a freshwater fish. I have saltwater fish over there. You're welcome, Cecilia. Thanks for being here. You can find more information about Livestrong, what we do, at livestrong.org. You can also find me on LinkedIn. I'm usually publishing 2 or 3 times a week, so pretty active up there on that platform. You can always find me. I put my email at the beginning of this chat, so you're always feel free to connect with me, and I'd love to intersect with any work that you guys are doing as well. So I'd love to know, am I optimistic? I am a glass overflowing person, so I am optimistic. We're going about this in 2 ways. So one, I'm personally working hard in every back channel that I possess, and some that I don't, to get to the administration from a federal level. That would be the most ideal way that this works, so that states are just going to look to the Fed. Instead of creating their own new rules, they'll just look to the Fed for guidance, which means they're just going to copy the rules that are already in the bill. So ideally, I get that language added to the federal bill that will allow us to know that states have to have that exception for cancer patients. So that would be the perfect scenario. I am working back channels there. I have a little bit of time, but my foot is on the gas. The second way we're going about this is through state by state, which is a little bit more exhausting, but we're doing it. So at Livestrong, we've got an advocacy program. It is made up of volunteers. People apply, they commit to fundraising, and they come to monthly meetings, but they are true advocates, and they are working with us and for us on the state level to get us into those state legislators' offices to have conversations about fertility, for one, and then this Medicaid issue as well. So we're going to go, we're going what I call guerrilla grassroots, so that if I can't work any magic at the federal level, then we will go state by state and see if we can't beat that December 31st, 2026 deadline for for states to have to start reporting. If you back time that, because I'm really back timing it, that's the first time the state has to report is by December 31st, 2026. That means in my mind, I'm going to go backwards 6 months, which means I really, by that summer, we need to have some language in place and lots of great communication to those 2 million plus people who, including children, I need to make sure that everybody understands what their rights are and what the new rules of Medicaid will be if they do have cancer. I think especially fragile will be that AYA community, those adolescents and young adults. So I think we're going to see some real challenges between, in the 19 to 30-year-olds. These are people who, generally speaking, if they're on Medicaid, it's because they've lost their job due to cancer. About 13% of people who get a cancer diagnosis lose their job. Either they needed to quit because they couldn't continue, or they were fired or let go or replaced because of treatment. So I don't know that I am always optimistic, but if I have to go state by state, that's going to be a lot harder in some states, as you might imagine, than others. Anything else? Any other questions? Anything at all? Yeah, you bet, Sarah. We'll see what happens. So if one day you see an announcement that cancer patients, that there's a line in that bill, you can say, oh my gosh, maybe I know who did that. I don't know. We'll see what happens. I'm just going to try to quietly get it inserted. We'll see. We'll see. So if any of you know anyone in HHS and would like to help, throw 'em my way. Yeah, you'll know it was me. Yep. Yep. I will be celebrating it, but not as a personal win, but as a win for everybody. So we'll see. Fingers crossed. Fingers crossed.